Hello and welcome to the June monthly briefing. This year I'm very keen to make sure our monthly briefings are a two-way process so that my messages address the questions you send in and address the topics which matter to you. So I'm going to start by answering two particular questions which many of you have asked after the April briefing. The first question was, when will there be Wi-Fi for service users? We know that access to the internet is a big part of many people's lives and is a way of interacting, feeling connected and staying occupied. The NHS is committed to give money to provide Wi-Fi access to patients and to staff, and we're committed to doing this in AWP. However, in mental health care there are some clinical considerations we need to resolve before we roll out the facility. Therefore, over the next few months, we'll be looking at how Wi-Fi is planned and used in other mental health trusts, and we'll be considering the systems we need to have in place to ensure that this technology is not detrimental to recovery. In the meantime, we'll continue to look at other activities and ways to promote activity and engagement on our wards and across our estate. The next question was, when will we hear about appointments into the new nursing and quality posts? Thank you to everyone who responded to the consultation for nursing and quality. The outcome of this was published just before the CQC inspection. And in fact, the new structure was endorsed by the CQC as good practice, which is good to hear. Appointments are being made now, but here are some details on the key posts so far. Associate Director of Inpatient Nursing is Liz Besant. The Head of Inpatient Nursing post is vacant and is being covered by Sarah Parks. The Associate Director for the Community is also vacant, and Sarah Jones is acting up before she takes up the role as Head of Community Nursing. The Associate Director of Academic Nursing is Alan Metherell. Mark Dean has taken up the post of Associate Director of Statutory Delivery, AHPs and Social Care Leadership. We will keep you posted as more appointments are made, and you can look out for a full rundown in the next issue of the Nurse to Nurse newsletter. So, moving to my messages, there are two short messages this month, and the first is about CQC and quality. Following my letter to you all in May, here are the next steps of the inspection process. The CQC has completed their inspection and we have had some early positive feedback. We are expecting the draft report by late August, including the overall rating. We will be allowed to comment on the report prior to the final publication in September. We have received one warning notice relating to the management of our Section 136 suites, including questions about variation in practice and concerns about the length of stay. We're working on solutions with our partners across the system, and we expect these to be in place so that the warning notice may be lifted by the time the final report is published. The Bristol warning notice from December has been lifted as all concerns have been addressed. By September, the whole inspection process will have been completed and we will be awaiting the date of our Quality Summit meeting. In the meantime, we will be continuing all of the quality improvement measures we have already put in place, plus some extra measures. We will be undertaking a peer audit of the fundamental standards of care. We will undertake delivery-wide self-assessments led by the delivery unit quality directors on a twice-yearly assurance cycle. And we will undertake quality review inspections, that is, delivery unit focused quality reviews led by associate directors from Nursing and Quality. These will help us ensure that we are constantly driving for improved quality and we're making that business as usual. We'll be taking a descriptive paper on this to the board this week, and so I can report more on that in the next briefing. Finally, it's the time of year when we recognise the brilliant things that our colleagues do. Staff Awards season. Nominations are closing in 2 weeks' time, and so I'm asking all of you to shine a light on a special colleague in our trust. Someone who's your role model, someone who inspires you, or who brings sunshine to a working day. Someone who deserves to be thanked and recognised. Please take a moment after you've watched this film to send in your nomination and make someone's day. Thank you very much for listening to this month's briefing. Let's keep talking to each other and please keep sending in your feedback.